Inhibitors of CDK4 and 6 have shown really very substantial activity in metastatic ER-positive breast cancer. And the questions now in the field is, how do we work out which individual patients get the most benefit from CDK4/6 inhibitors? So we've been trying to work out how cancers become resistant to CDK4/6 inhibitors, partly to help us treat patients whose cancers progress on them, but also we're doing a lot of work to understand why individual cancers respond to CDK4/6 inhibitors that we hope in the future will allow us to develop biomarkers to pick out which patients respond. ER-positive breast cancers are really exquisitely dependent on CDK4 and 6 for their growth. So both the estrogen receptor and CDK4/6 work together to promote the growth of these cancers. So targeting CDK4/6 makes a great deal of sense biologically to treat these women. There's a lot of interest with CDK4/6 inhibitors at the moment in addressing whether they have activity in the adjuvant setting. So there's a large number of studies currently recruiting with CDK4/6 inhibitors to address whether they can improve survival in the adjuvant setting. It's going to take a lot of years for these studies to report out, but I think that's the next big question we need to address with these inhibitors. Well, I think the take-home messages are that CDK4/6 inhibitors have substantial activity in women with metastatic breast cancer, but importantly, they're also really quite well tolerated. There's a lot of blood test abnormalities, but many patients feel pretty normal while they're taking the drugs. And this is then reflected in the data that shows they also have very good quality of life when they're taking them. They look like they're tolerated very well, and therefore they're drugs that we hope will have that potential to move into the early breast cancer setting.